So our next discussion brings together people from a number of different perspectives to talk about priorities in global health. We'll have Jeremy Farrar, who's the chief scientist at the World Health Organization, Michael Marmot, who I already mentioned, who's the director of the Centre for Health Equity at University College London, Sania Nishtar, who's the CEO of Gavi, the Vaccine Alliance, and Carl Skau, Deputy Executive Director of the World Food Programme, where he's also Chief Operating Officer. This discussion will be moderated by Mariam Claeson, who is a senior advisor at the School of Global Public Health at Karolinska Institute. So please welcome them all.
Great. It's wonderful to be here with these distinguished panelists to talk about the current state of health, the huge threats into the future, and what we can do about it. I will start where Ola referred to later today about the aging population. With the growing aging population, we also have growing burden of non-communicable diseases, cardiovascular diseases, cancers, NCDs as we call them. And Sania, I'm going to ask you to put on your political hat as a former senator, a former minister in that block in the middle of transitioning economies, countries that are moving towards mid-income, and where you are faced with a dual burden, both the unfinished agenda of mothers, newborns, children, reproductive health, communicable diseases, and at the same time, this growing burden of non-communicable diseases. How do you prioritize in those scenarios, and what can we do?
Well, first of all, thank you for having us on this very prestigious panel. If I put on my hat of a former government minister, in the health sector, clearly you're looking at the unfinished agenda, and then you're looking at diseases, the non-communicable diseases that are rising. And in terms of the drivers of health, I think one must not always forget that the social determinants of health, as Sir Michael will tell us better than anyone else, is where you need to focus first. Because income, employment, education, reduction of poverty, the government social policy, clean air, sanitation, clean water, decent housing conditions, these have the strongest bearing on health status achievement. And clearly there's a huge interplay of government's policy, government's redistributive ability, and the robustness of the government institutions to deliver. And in that same vein, if governments are effective, they can create the enabling environment and the right regulatory arrangements to be able to tackle non-communicable diseases as well, and to promote healthier choices, which is what cross-cuts with healthier diet, physical activity, tobacco use, cessation, and reduction of harmful use of alcohol. So I would say that the government has a hugely important role to play in both these areas.
Thank you so much, and that's a very nice segue into what you have been working on, Michael, for many years, both thought about and taught about inequities, systems, and how we can strengthen that across the board.
Let's start with two obvious things. When people talk about health and health inequalities, the first thing is they tend to conflate health and healthcare. We know if you're sick, healthcare is important. No question, it's obvious. And we know poverty is bad for health. Both of those explain very little of the inequalities in health we see within and between countries. Let's take poverty. Go, thinking of Ola's slides, go to a low or middle income country, classify people by some measure of income or economic conditions, and what you see is a gradient. It's not just that the poor have high under 5 mortality, it's graded, and it goes all the way from top to bottom. If you go to southern Brazil and look at cardiovascular disease and classify districts, it's graded. It's not just that the poor have higher rates of cardiovascular disease, it's graded. It means we've got to deal with poverty, of course, but we've got to deal with inequality and understand much better, and I have been leading the charge on social determinants of health, to understand. And we heard a brilliant introduction this morning from the chair, and it was brilliant. I would disagree with her in one respect. She said, well, there's science and then there's society and politics. We can study that scientifically. We can study how those social forces and political forces and economic determinants impact on health. And we have to.
Carl, one area which Ola shows us is this thinking around the north versus the south, high income versus low income. And in your field around nutrition and food, that's one area where I think we are very much stuck into thinking that obesity, overweight is part of high income countries and not existing in low income, where we're thinking about nutrition in a sort of simplistic way. But I think you know very well, we have areas where hunger and starvation is the biggest challenge. We have obesity and overweight in low-income countries, and we are growing sort of a global picture of underweight and overweight and malnutrition. And we still have the unfinished agenda that Sania talked about, where malnutrition drives 50% of deaths among children who die prematurely. So great to hear your thoughts about this.
No, thank you, and great to be here. I mean, we work across all those areas that you spoke of, but I must say that this morning my head is very much in Syria. We have 500 staff in Syria, offices throughout the country, and that's just the latest crisis. Very much uncertainty, of course, what's going to happen, but like WFP does everywhere, and why we got the Peace Nobel Prize 4 years ago, we are there already delivering, whether it's in Homs, Hamas, and this morning trying to find ways also in Damascus. A lot of uncertainty, but what's certain is that people need to eat. And if they don't eat, there will be starvation. And so food is, as always in this crisis, the #1 priority when it comes to humanitarian assistance. But this is getting increasingly difficult, because since we got the prize in 2020, the number of acutely food insecure, and that's people who have been hit by a shock, not chronic food insecurity. It's either a natural disaster or a war or some other shock, has increased threefold. We're now at some 345 million people who are acutely food insecure, and that's, as I said, 3 times only in 4 years. The resources to try to address this has remained more or less the same. For WFP, still significant. We're the largest UN agency, but far from enough. And so we are having to make really tough priorities. If I take the example of Syria again, 3 years ago only, we assisted some 6 million people. This year, we were down to 2 million. And that's a country where 3 million are determined to be in the kind of acute phase of hunger, what we call IPC 3, 4, or 5, meaning that we had cut off 1 million people who frankly were starving, mothers with many children. I was there a couple of months ago, and they frankly said it was better during the active phase of the war because, well, we had bombs over our heads, but we had food for our children. So, we need to be creative. How do we tackle this gap between these rising needs of acute food insecurity with the existing resources? And of course here, innovation will be key in the nutrition field. How can we find ways, data-driven, evidence-based, innovative solutions, whether it is about fortified food or other ways to really try to address this gap. But partnership also key, working with WHO and others. This is not something WFP can do by itself. We need to work governments, NGOs, and all the partners to tackle this challenge.
Yeah. So, Carl, we often say that give a fish and you have food for the day, but teach to fish and you will have food forever. What I think we hear you say is there is a role for a fish as well as fishing. So you're hitting a very important point. And you pointed at our colleague Jeremy from WHO. We can have this discussion. We can have a discussion throughout the day that's driven by science and data. Some emerging health problems, large crises, do not have a solid database. If you take mental health, we still have a very weak basis for making decisions. And where there is data, there's action. Where there's no data, we often lack action. So how can we get more facts to drive priorities? in the current circumstances. And Jeremy, I want to add another question to that. Some areas we have plenty of facts, like in the cost effectiveness and the value of vaccines, but we're facing alternative facts that are threat to the areas where we think we have a solid basis. So how, as a science director at WHO, do you tackle these scenarios?
It's a challenge. I was just talking to Charlie Rice there before we came in, and one reassuring thing is on a relatively dark 9 o'clock morning on a Monday morning, there's a huge audience here and online wanting to talk about science. And this whole week is a celebration of that activity. So amongst the deep challenges the world faces at the moment, we mustn't lose our sense of hope and optimism, or our sense of inspiration, because ultimately that is what science is about. We live, certainly in my professional career, and I'm old enough to remember the Cold War. I was brought up in Tripoli, Libya, some tough countries. I've never known another more uncertain era to have lived through, to be honest. And myself, and I'm sure many in the audience, and certainly young people, are turning off the news because they just don't want to watch what's happening. And we're turning away and we're turning inwards. I think if you look at all of the great challenges we face, from food, and it's great to be here with the colleagues here on and vaccination, science has a role to play in each and every one of those, in my view. But I think we also need to have the humility to say that science on its own won't provide all of the answers. We are in a scientific golden age. But unless we reconnect, and my concern is we are diverging science from societies and communities, and we're diverging science from policy and political masters. And I think we have to reconnect those if we're going to try and ensure that the best evidence available is going to be informing the way policies are developed. And if we allow this scientific, societal, community, and politics to increasingly diverge, then I think whilst we won't move into a post-science era, we run the risk of not allowing our scientific evidence and guidance to at least inform policy making, whilst always in democratic and non-democratic systems, ultimately policymakers may hold those answers. In order to do that, I think we have to reconnect with the societies we're part of. And Assi, who used to be head of International Red Cross and Red Crescent Society, taught me something. Everything ultimately starts with communities and individuals and their families, and we must reconnect with those. And if we're not careful with the way that science is going on in a smaller number of countries, and in countries a smaller number of institutions, we will allow, if we're passive, science to increase inequality.
Sania, I'm sure you have thoughts about this, being a leader of a group that is trying to ensure that every child is vaccinated and nobody's left behind, and at the same time facing these sort of alternative facts around vaccination. How do you tackle that?
Tackling alternative facts about vaccination, well, there's this huge buzz about vaccine hesitancy, but what we're seeing from countries is very different. We're seeing a huge demand for vaccines from countries. Of course, there are naysayers, but I would say that in the day and age of social media, the noise gets disproportionate to the actual level of the problem. I mean, I've had deep engagement with implementing countries. I've been to several countries in Africa. I was recently in the Solomon Islands. And mothers really value vaccination. Governments really value it as one of the most effective tools to reduce child mortality, which is what we just saw. There's a huge demand for new vaccines, such as the malaria vaccine. The world is really waiting for the tuberculosis vaccines, as Jeremy will tell you. The human papillomavirus vaccine against cervical cancer is one of our most effective vaccines, and there's a huge demand for it from countries. So yes, there's an element of vaccine hesitancy, but I would say the noise is disproportionate to the size of the actual problem, and the evidence of that is the demand that we see from countries. We have a huge pipeline that we are actually unable to, we're struggling to serve. But that should not make us complacent, and there clearly is an imperative to dispel the myths and the misinformation and to rely on evidence and information. And that's part of what we're focusing on.
You know, you're optimistic, and Jeremy too talked about optimism, and that shifting sort of the global to the local focus and look what the local demand is a very important part, I think, of thinking about globally, not just as a sort of global average, but what happens at local level. And some people saying it's time to shift from global to glocal and to think locally. Now, Carl, what about you? You talked about the difficulties of setting priorities, maybe at the expense of other problems. How can we avoid that?
Well, you know, when I listened to the panel and the panel before as well, I wish I was, you know, a carrier of more good news. I'm often with the bad news. I'm on the fish side, as you said. But we are also doing other things. I mean, if I point to something, it would be the homegrown schools meals project. You know, I grew up here in Sweden. Having a school meal was, you know, and it was given to me, and it's been so for the past few decades. But this is now a concept that is, you know, taking momentum across the world. We set up a school meals coalition with Brazil and France in 2021 with an ambitious objective by 2030 to have all children in the world having a school meal. And the beauty with this concept is not only that it brings a nutritious meal a day to every child, but it also brings kids to school, not least girls. It improves the outcome of education. And if you do it in this homegrown concept, it also promotes local economy, farming locally. We hire women from the community into the kitchens. And so we've done this in 100 countries for the past few decades, and we're now bringing that concept together to governments. You know, I was in Indonesia a couple of weeks ago. It's very exciting. The new president who come in there has declared that they're going to roll out this universally in Indonesia, and that's not a small thing. It's 85 million children, 85 million children. So we've set up a team of 20 people to sit with the president's office to see, okay, how did we do this elsewhere? And so some good news, I guess, I can bring to the table.
Right. Now, I'm going to put you on the spot, all four of you, and ask you how you would prioritize if you were forced to actually make a priority in global health. Why do we talk about priorities? Unfortunately, we are in an economically constrained environment, and we have to make priorities, especially with investors who are looking for the best buy. Michael, how would you prioritize? What would be your one priority, if I may ask?
It happens to me commonly. I produce a report. We have 8 domains of recommendations, and somebody says, what's the one thing you would recommend? And my response, one thing? Read my report. I would not. I've been an advocate for the importance of early childhood. We investing in our children, get better education, early child development, nutrition, free school meals is part of it. Invest in our children. I would not throw old people on the scrap heap. I have a vested interest. The number of people who asked me this morning, can I help you with your bag? I thought, oh my God, I look worse than I feel. And I wouldn't prioritize housing and forget work.
Yeah.
And I wouldn't prioritize education and forget housing. And governments and non-governmental organizations do all of these. I think what you're doing is absolutely wonderful, but what you're doing is wonderful. And I wouldn't say give it all to him and don't give any to her. So if I was asked for one thing, I would say put equity of health and well-being at the heart of all policy making.
Thank you. So, Jeremy, what about you?
Yeah, I've learnt over many years not to usually disagree with Michael. And I helped you with your bag this morning as well.
Made me feel even worse.
I think the same as goes true, Michael. I think we have to also, Ola said it this morning, celebrate successes. We don't, as a community, do enough of the celebration. I think we have to reconnect evidence, science, with communities and with societies. And from a scientific perspective, I think if we must not, in the coming years, be passive in assuming some trickle-down effect of the benefits of science, we're going to have to be much more active and ensure that this scientific golden age doesn't lead to increasing inequality between and within countries.
Right. And wouldn't you say that there are so many interventions, programs with solid evidence base that that's not the distinguishing factor anymore? There are other factors that come into play beyond sort of the body of evidence we have, the political economy around how we make decisions and priorities.
Sure, but that sort of a little bit of what I was getting at earlier, this divergence that's gone on, I think, between the political class and the so-called scientific class and the bits in the middle, which we're really all part of. We have to reconnect those because I think most governments in most parts of the world want to make better decisions for their citizens, but increasingly that's focused away from a degree of expertise into a degree of ad hoc decision-making within some countries. And I think making sure that our scientific advice into governments is sustained over time, not just in a crisis, and that we don't allow the culture and languages between the so-called scientific and the so-called political communities to diverge any further, but we ensure that they come together.
Can I pick up the free school meals, the school meals? I've been interested in this. In Britain and many other countries, we have means-tested benefits. Let's direct all our programs at the poor. In the Nordic countries, by tradition, you've had universal programs. So here we have a tussle. My own view, and it relates to what Jeremy just said, is let's look at the science. Take free school meals. Should we give it only to poor kids, or should we give it to all children? Well, let's evaluate it. Now, in fact, I think the evidence is fairly good that if we have universal free school meals, there's real benefit. There will be politicians and people who reject that. That's, in a sense, okay, provided they're rejecting the evidence. They know what they're doing. If they say you're a communist because you want to give everybody free school meals, that's not legitimate discussion. If they say, no, I just don't want to, you know, my predilection, it may be good, but I don't want to do it because it doesn't feel right. Okay, that's politics, that's normal life. But let's get the evidence. I think the evidence is in favor of universal free school meals. And I'd like to have that out there, make that part of the deliberation, the discussion. And then if people say, we won't do it, they know they're damaging children's health and well-being by rejecting it.
Thank you. Carl, maybe you want to pick up on that. What would you advocate as maybe the most powerful intervention in addressing malnutrition?
Well, I was going to say school meals, but that's already gaining traction.
So you don't need to cover that one.
So, I mean, instead I would probably say prevent and end conflicts. Frankly, you know, I talked about the threefold in acutely food insecure. Partly that's driven by climate change because of extreme weather events, but the large numbers are really coming from conflicts. Sudan, 25 million acutely food insecure, half the country. And no one talks about it really. But really what we need is to end the war in Gaza, we need to end the war in Lebanon, we need to end the war in Sudan, and we need to now make sure that Syria doesn't implode and that there is no other war on the horizon. I'm not too optimistic, to be honest. Again, I'm not the carrier of good news, but certainly that would be the one thing that I hope for, and maybe around the corner there is an opportunity for that.
Thank you. Sania, you get the last word in terms of your choice, you were challenged with that in the beginning, and you gave a very nice presentation across the board, but would you pick something to advocate for to investors on invest in this, and that's going to be a major share of the burden that you are averting through this intervention?
So just before I come to my choice of intervention, I just want to quickly connect back with your reference to the President of Indonesia. We had the privilege of meeting him 3 days ago, and he talked at length about his aspiration for a school meals program in a country as large as Indonesia. And I'd completely agree with you, Michael, because a school meal program ticks a number of different boxes. So it makes sure that girls are in school, it prevents school dropout, it's one of the most effective tools against malnutrition, builds human capital, which is the most important investment in today's economies. And of course, it's good for the local, for the local economy as well. And it was really inspiring to hear him talk about school meal programs at scale. But coming to your question about the one priority for global health, I think in terms of the principle, I cannot disagree with you, Sir Michael, that it has to be equity. But then in terms of the most effective intervention, I would argue for vaccination, for reasons other than the fact that I'm the CEO of Gavi, the Vaccine Alliance, because facts speak for themselves. Vaccines have been one of the most significant contributors to reducing child mortality, halving child mortality, as we saw upon the screen today. Secondly, we know that when it comes to a pandemic threat, it's not a question of if, but it's a question of when. And although vaccines are not the silver bullet, they are one of the most important tools in our toolkit. Thirdly, I would say vaccines, because we have the mechanisms in place to intervene at scale. And fourthly, I'd like to mention something which is not common knowledge. The frameworks that we have in place actually promote sustainability as well, because today Gavi is working in close to 57 countries, and countries co-pay for their vaccines. So this year, countries have paid more than 200 million in co-financing payment, and as we proceed forward, this will further increase. So reducing mortality, an investment with respect to pandemics, mechanisms for scale, and tick the box on sustainability, I would argue for them to be a priority.
Thank you. This is a great note to end on. So thank you to all four of you.
Thank you.
Thank you.